I have worked at Great Lakes Bay Health Centers for a long time. I thought I would be here for 3 years to fulfill my health service corps obligation. Like good relationships, the longer you're in them, the better they get, and so I'm still here today.
Anytime I let people know that I work for Great Lakes Bay Health Centers, they just light up. They're like, oh, you work there? Great Lakes Bay Health Centers has a reputation for helping the community and for being kind to its employees.
The group of people who choose to work here and who continue to choose to work here, there's a reason that they do, and there's a heart there.
In the 5 years that I've been working at Great Lakes Bay, I've never woken up once and been like, oh, I gotta go to work. I choose to stay at Great Lakes Bay Health Centers because I really do believe in the mission, and I've worked it, lived it, and I see it every day. So I've been a social worker for 10 years. So half of my career I've spent with Great Lakes Bay Health Centers, and they welcomed me in as just a licensed therapist, not just giving me financial support for education and CEUs, but also mentoring and guidance to move up my career in a supervisory role, which is how I became a coordinator, and really kind of fed my interests. I never thought that I would be working with the maternal or infant health department, and then I had children of my own and learned that I had a interest in helping other moms postpartum with their mental health, and the company fed that, and here I am helping to facilitate a program that serves Saginaw County. And quite honestly, Saginaw County has 1 infant dies a month due to unsafe sleep spaces, and my company is in the throes of it. How do we get them pack and plays, and what do you guys need? Do you need more case managers, or how can we do more home visiting? So we're not on the sidelines waiting for someone to tell us what they need us to do to help them. We're in there helping.
Great Lakes Bay Health Center has given me the opportunity to fulfill a dream of myself, coming as a migrant worker background and fulfilling that dream of helping others. Migrant services, what it does is we go out and serve agricultural workers. This would be accompanied by medical and dental units. We visit over 40 sites. This would be migrant camps and dairy farms. I jumped in here with the intention of sticking around for a little bit as a bilingual receptionist back then. Things came along together great. I went back to school, became a medical assistant, assisting workers and talking to folks on the tongue they can understand, explaining their bills and what they're paying for services, and interpreting for the providers as well. That was a dream. I mean, being able to interpret for a patient where the patient's very concerned and explain to them what the process was going to be of their procedure. And at all points, the patient was feeling trust with me and the doctor. I mean, this is a facility where folks are welcome to come in because they build that trust with the provider. There's someone that can speak my tongue, and they totally feel at home when they come out here.
I have been working with Great Lakes Bay Health Centers for 17 years. Sonography is something that I have a huge passion for, and privileged to kind of have different mentors here and different people kind of lead me. The group that I work with, we do a really great job of taking care of all the babies in our community. And I really just am so proud that we can offer such great ultrasound services to this community, because so many other facilities aren't able to deliver the level of ultrasound that we do. We know how to take care of the patients. We know how to guide them in their care during pregnancy and after pregnancy, and even for pediatric care. Some women come in and they may not have any support or any guidance, and they may be new to the area, and we can kind of take them under our wing and help them navigate a very scary time when you're a new mom and going through all those things. So I think for the most part, I'm most proud just to be able to help all of these women daily. I mean, there's many of them that come to our door, and at the end of the day, they have a better outcome because we're there.
I think the other thing, though, that's different than you're going to find in a lot of healthcare jobs that Great Lakes offers is there is a holistic approach to how we do medicine. Great Lakes puts a lot of players on the field.
My favorite thing about working here is truly being able to collaborate so closely with all the different disciplines that we have within the agency, because that makes it easier for us to offer the best possible patient care. We don't have to worry about trying to coordinate services with outside agencies because 9 times out of 10, we can provide it in-house.
And we have so many great people on our team, our community health workers, our care management nurses, our transportation, our front desk, everybody. There are so many people that are part of the team, and working together, we just do these incredibly awesome things and really change people's lives. And so I really love that we have this team of multidisciplinary people taking care of a patient, and really providing that whole person care is very gratifying.
We have relationships with everyone in our company, whether it's providers, front desk staff. You know, you come into contact with someone from different departments all the time, and it's just really family dynamic. We're the family away from the family because, let's be honest, we're together more than we are with our families. So it's not just a career opportunity. This is like one of your life-changing experiences.
And if you want to be a part of something that isn't just about revenue or profit, but puts people and health and well-being sort of front and center, sign up, man. It's a fun place to be.